Stand up right now. Go ahead. I'll wait. Now concentrate on what just took place inside you. Did you feel a slight tightness in your joints? Maybe a small ache or tension in your lower back? Or that common urge to sit down immediately because standing starts to feel uncomfortable after just a few seconds? That very same silent but genuine pressure is occurring every single day deep inside your blood vessels, and it is far more hazardous and concerning than most individuals ever truly understand or recognize. The American Heart Association indicates that almost half of all adults in the United States, approximately 122 million people, are living with elevated blood pressure. And here is the really startling and concerning detail. 75% of those individuals are depending on prescribed medications to keep it managed. Nevertheless, more than 675,000 Americans pass away each year from issues directly connected to high blood pressure, even though they stick to their medication routine faithfully every single day. I'm Dr. Michael Kent, and after more than 2 decades working as a cardiac surgeon, conducting open-heart operations, and directly observing the internal state of human arteries during numerous procedures, I can precisely explain why those medications so frequently do not provide a genuine long-term fix. The knowledge most people are given about elevated blood pressure is significantly lacking and rests on outdated ideas that have not evolved with modern insights into vascular science and disease development. You have most likely been informed that high blood pressure is basically a matter of too much pressure inside the tubes, similar to a water system with excessive volume. Lower your salt consumption, use a water pill, reduce the pressure, and the issue is resolved, correct? That description comes from medical thinking that originated 50 years ago and no longer captures the complete reality or the actual root cause. The situation is considerably more intricate and extends much further than simply fluid quantity or surface readings on a monitor. High blood pressure is not primarily about excess fluid pressing against the walls. It is about the true condition and state of the tubes themselves. Your blood vessels become harmed, lose their natural stretch, and deteriorate at the tiny and cellular level year after year. Medications can temporarily decrease the numbers you observe on your blood pressure monitor, but they cannot heal or undo that internal structural injury happening inside the vessel walls themselves. During bypass operations, when I open the chest area, the contrast is instantly visible to the eye. Healthy blood vessels react with flexibility when touched or cut. They bounce back like rubber. Blood vessels affected by prolonged high blood pressure feel rigid and unyielding like bone when incised, brittle, filled with calcium buildup, hardened and inflexible. And that inflexibility and loss of stretch, that is what high blood pressure genuinely signifies at its core. The medications may modify the figure you see for some time, but they leave the basic rigidity and cell-level breakdown in the vessel walls entirely untouched. That is exactly why countless people continue on medication for decades, yet their chances of heart attack, stroke, kidney damage, and other dangerous complications remain high, even when the readings look acceptable or managed on paper. By the end of this video, you will completely understand the 4 hidden processes that generate and maintain high blood pressure, together with the full 4-step approach to restore and mend your blood vessels at the structural and cellular level. This method is based on cellular biology and biochemistry that you can start using today to begin reversing the harm that has built up quietly for many years. Before we proceed, please leave a comment with your age. I want to see who is prepared right now to take genuine charge of their blood vessel and heart health and make important changes. Let me explain in plain and direct words what is really happening in your body that almost nobody describes correctly. As you enter your 60s or 70s, your blood vessels experience 4 major shifts that directly influence blood pressure and the general state of your cardiovascular system. These shifts develop slowly and without clear signs over many years, but they set up the perfect conditions for increased blood pressure that worsens steadily unless the main issues are handled properly. The first process is the breakdown of the glycocalyx and injury to the endothelium. Imagine your blood vessels as smooth, non-stick pathways made for easy blood movement without any friction or resistance. The innermost surface, called the endothelium, is a single layer of cells thinner than a sheet of paper. It is covered by a tiny protective layer called the glycocalyx, similar to a non-stick surface inside a cooking pan. This layer allows effortless blood flow, triggers nitric oxide release to keep vessels open and relaxed, and prevents inflammatory particles from attaching to the vessel lining and causing internal trouble. The difficulty starts when prolonged high blood sugar, ongoing low-grade inflammation, past or present smoking, and oxidative damage from free radicals slowly wear away and destroy the glycocalyx layer. Once that protective layer is gone or badly damaged, the vessels become stiff, inflammatory particles stick more easily, LDL cholesterol enters the wall, and plaque begins to form inside the vessel. Here is the important fact most people never hear. No high blood pressure drug rebuilds or repairs the glycocalyx. ACE inhibitors, beta blockers, diuretics, calcium channel blockers, they change the number on your monitor, but leave this crucial shield unrepaired and unprotected. That is why people can have managed blood pressure on drugs yet keep developing heart disease, strokes, or kidney failure over time. The glycocalyx injury continues quietly, and the drugs treat only the visible symptom, high pressure, not the main problem, loss of protective covering and increased risk. The second process is blood vessel hardening and calcium accumulation. Most doctors focus only on blood pressure numbers, ignoring whether the vessels remain flexible or have become rigid. Blood vessels should stretch and bounce back like elastic bands with each heartbeat, absorbing pressure and helping smooth blood circulation throughout the body. Long-term high blood pressure, diabetes, ongoing inflammation, and aging damage the tunica media, the middle layer responsible for that flexibility. Calcium builds up inside the wall, elastic fibers break down, and smooth muscle cells change into bone-like structures, promoting further calcification and hardening. This hardening is measured by pulse wave velocity. Healthy vessels conduct the wave at 6 to 7 meters per second. Rigid vessels push it at 12-15 meters per second or faster. Faster waves indicate greater cardiovascular danger because the heart has to work harder against stiff tubes. No medication removes those calcium deposits or restores lost flexibility. However, specific nutrition and lifestyle steps aimed at the cell level can partially reverse some calcification and reduce rigidity over months and years of steady effort. The third process is low nitric oxide. Nitric oxide is a gas molecule produced by endothelial cells that keeps vessels open. Made through the ENOS enzyme, it tells smooth muscle to expand, lowering resistance and helping blood pressure stay normal. Damage to the glycocalyx impairs ENOS function. When ENOS becomes unbalanced due to oxidative stress or BH4 cofactor shortage, it produces harmful free radicals instead of useful nitric oxide. Without enough nitric oxide, vessels stay tight, resistance increases sharply, and blood pressure rises. Research shows isometric hand grip exercises, gripping at 30% of maximum strength for 2 minutes, resting 1 minute, repeating 4 times, activate ENOS and raise nitric oxide naturally. Switching to nasal breathing instead of mouth breathing increases nitric oxide by up to 400% because the sinuses release it during inhalation. When nitric oxide levels drop consistently, vessels remain tight, and no drug fully recreates this natural relaxation system the body is designed to use every day. The fourth process involves the insulin-kidney connection. Many do not realize sodium restriction fails for many because of high insulin levels. Chronic high insulin forces the kidneys to hold on to sodium regardless of how little salt you eat. Insulin promotes sodium reabsorption, activates the sympathetic nervous system, stress response, and increases sensitivity to angiotensin II, a strong vessel tightener. This explains why insulin-resistant people, even without diabetes, often develop high blood pressure that is hard to control. Fasting blood sugar and A1C may look normal, but ongoing high insulin quietly causes sodium retention and keeps blood pressure high. This process explains why many older adults have resistant high blood pressure, despite low-salt diets and multiple medications. The insulin problem keeps kidneys holding sodium and fluid, maintaining pressure elevation. Consider two real-life examples to make these processes clear. John, age 71, dealt with high blood pressure for 13 years on 2 medications. Readings averaged 130/82, but tests revealed endothelial dysfunction and low nitric oxide markers. He experienced constant anxiety, tiredness, and frustration. We began the vascular repair protocol, controlled blood sugar with eating window restrictions and carb reduction, added fucoidan 800 mg daily for glycolytic support, and boosted polyphenol intake from berries, leafy greens, beets, and dark chocolate. After 12 weeks, endothelial dilation rose from 5% to 13%. Blood pressure fell to 116/74 without extra drugs, and he regained energy, confidence, and daily independence. The glycolytic started healing, nitric oxide increased, outcomes drugs alone could not produce. Martha, aged 74, had high blood pressure for 18 years, used 4 medications, and showed severe arterial calcification on CT scan. Vessels appeared stiff and bone-like. She felt fearful, drained, and skeptical about improvement. We focused on decalcification, vitamin K2, MK7, 360 mcg daily to activate matrix GLA protein, vitamin D 6000 IU daily for proper calcium direction, and magnesium glycinate 600 mg daily for balance. After 6 months, her calcium score dropped 9%, blood pressure reached 122/78, and she reduced to 3 medications under supervision. After 18 months, she was on 1 medication with strong control, and CT showed 16% calcification reduction. These cases prove how repairing structural vascular damage, targeting glycolytic injury, calcification, nitric oxide shortage, and insulin-driven sodium retention can transform health when root causes are addressed instead of just symptom control with more drugs. Now let me teach you the vascular protocol, a 4-step method targeting these processes directly. Step 4. Glycocalyx restoration. Keep post-meal blood sugar under 140 mmol/dl through eating window control and carb management. Supply repair materials with fucoidan 600 1000 mg daily, a seaweed compound supporting glycocalyx rebuilding, and lower oxidative stress using polyphenol-rich foods like berries, leafy greens, beets, dark chocolate, and green tea. This step rebuilds the protective film, enhances circulation, decreases inflammation, and helps stop plaque. Step 3. Decalcification. Activate matrix GLA protein with vitamin K2, MK7, 180/360 mcg daily to stop calcium artery deposits, support correct calcium placement in bones with vitamin D 6000 IU daily, and add magnesium glycinate 400/600 mg daily to manage calcium and relax vessels. This step gradually softens rigid arteries and reduces calcification. Step 2. Nitric oxide restoration. Protect enos cofactor BH4 with folate 400/800 mcg, vitamin C 1000/2000 mg, and vitamin E mixed tocopherols. Stimulate enos through isometric hand grip training, 30% max strength, 2-minute hold, 1-minute rest, 4 repetitions 4 times weekly, and practice nasal breathing to raise nitric oxide up to 400% over mouth breathing. This step naturally relaxes vessels and lowers resistance. Step 1. Insulin reset. Lower insulin with time-restricted eating, 16.8 fasting, eating window noon 8 p.m. is a good start, and resistance training 2 and 3 times weekly to boost muscle insulin receptor sensitivity. Step 1 is most powerful because it frees kidneys to balance sodium and pressure, tackling many resistant hypertension cases. Here is what you can realistically expect when following the protocol. In week 1, subtle changes may appear: reduced morning stiffness, slight pressure drop, and a small energy boost. By week 2, systolic pressure often drops noticeably. Many experience 8 to 15-point reduction, and energy and mood lift noticeably. Weeks 3 to 4 show measurable vascular improvements, increased nitric oxide, and early calcification reversal on follow-up tests for some. Beyond week 4, structural changes emerge: decreased arterial rigidity, lower cardiovascular risk markers, better endothelial function, and possible gradual medication reduction under doctor guidance. This is not simple symptom relief. It is structural vascular transformation addressing root causes at the cellular level. Let me be very clear. This protocol is not a hypertension cure and is not a substitute for medical care. Never stop prescribed medications without clear physician approval. Those with kidney disease, heart disease, or diabetes must follow these steps under close medical oversight to prevent complications. Start slowly. Choose one step initially. Track blood pressure daily, morning and evening, and note how you feel. Add further steps gradually as your body adjusts safely. Always collaborate with your doctor to understand changes and modify appropriately. Here is my challenge. Select one element of the vascular protocol, perhaps post-meal blood sugar control, vitamin K2 supplementation, hand grip exercises, or time-restricted eating, and stick to it consistently for 30 days. Track results carefully: blood pressure numbers, energy levels, mood, stiffness changes, then return and leave a comment sharing what occurred. Your arteries have carried you through decades. They deserve repair and attention. If this information was helpful, subscribe so you don't miss future videos. Next week, I will discuss the single most overlooked nutrient for cardiovascular reversal, and one tip will surprise even experienced physicians. Stand up for a moment. Did you notice any stiffness in your knees or back? That same silent stress is occurring inside your arteries right now, and it is far more serious than most understand. The American Heart Association states nearly half of American adults, around 122 million people, have high blood pressure. Here is the shocking part: 75% are on medication to manage it. Yet annually, over 675,000 Americans die from hypertension-related issues despite following prescriptions faithfully. I'm Dr. Michael Kent, and after more than 20 years performing cardiac surgery, I can explain why drugs frequently fail to fully control this condition. Most are told hypertension is a plumbing problem: too much fluid in the arteries, reduce salt, use a diuretic, monitor numbers. But that explanation is outdated, incomplete, and leaves millions at risk. The true issue is not fluid. It is arterial damage and rigidity at the cellular level. Healthy arteries are elastic, recoiling with blood flow. Long-term high blood pressure destroys that elasticity. Medications adjust numbers but cannot repair damaged arteries. By the end of this presentation, you will understand the 4 hidden processes causing hypertension and the 4-step method that can naturally repair arteries at the structural level. Before continuing, leave a comment with your age and how long you have had high blood pressure. The first hidden process is glycocalyx destruction and endothelial injury. Imagine arteries as smooth, non-stick channels. The endothelium is a single cell layer lining every artery, shielded by the glycocalyx, a microscopic protective film like Teflon. This layer ensures smooth blood flow, prevents inflammation, and produces nitric oxide to keep vessels open. When damaged by high blood sugar, chronic inflammation, smoking, and oxidative stress, the glycocalyx erodes. Once compromised, arteries stiffen, plaque develops, and nitric oxide decreases, raising blood pressure. Hypertension medications do not restore this coating, which is why many feel at risk despite controlled readings. The second hidden process is arterial rigidity and calcification. Doctors often focus on numbers, but ignore flexibility. Arteries should stretch and recoil with each heartbeat. Long-term pressure, diabetes, and inflammation harm the tunica media, the middle layer providing elasticity. Calcium accumulates, elastic fibers break, and smooth muscle cells turn bone-like, promoting hardening. Pulse pressure, systolic minus diastolic, indicates this. Normal is 40-50 millimeters. Over 65 suggests rigid arteries. Pulse wave velocity measures stiffness. Healthy arteries conduct at 6 to 7 meters per second, rigid ones at 12 to 15 meters per second. No drug removes calcium or restores flexibility, but targeted nutrition and lifestyle can partially reverse it. The third hidden process is nitric oxide shortage. Nitric oxide, produced by endothelial cells via ENOS, relaxes vessels. Glycocalyx damage impairs ENOS. Uncoupled ENOS generates free radicals instead of nitric oxide. Without sufficient nitric oxide, vessels stay tight, resistance rises, and pressure increases. Isometric hand grip exercises, 30% max strength, 2-minute hold, 1-minute rest, 4 repetitions 4 times weekly, stimulate ENOS and lower systolic pressure, 8 to 12 points. Nasal breathing raises nitric oxide up to 400%. The fourth hidden process is the insulin-kidney link. Elevated insulin prevents kidney sodium excretion, raising pressure. This occurs in insulin resistance without diabetes. Time-restricted eating, 16.8 fasting, and resistance training improve insulin sensitivity, freeing kidneys to excrete sodium normally. Examples show these processes clearly. John, 71, had hypertension 13 years on 2 medications. Readings averaged 130/82, but tests showed endothelial dysfunction. After blood sugar stabilization, 800 milligram fucoidan daily, and polyphenol-rich foods, berries, greens, pressure fell to 116/74 in 12 weeks. Endothelial function improved, and medication reduction occurred after 6 months. Martha, 74, had hypertension 18 years, 4 medications, severe calcification on CT. With vitamin K2, MK7, 360 mcg, vitamin D, 6,000 IU, magnesium glycinate, 600 mg daily, calcium score dropped 9% in 6 months, pressure reached 122/78, and medications reduced to 3. After 18 months, calcium score improved 16%, and she maintained control on 1 medication. The 4-step vascular protocol targets these processes: glycocalyx restoration, blood sugar under 140 mRDL post-meal, fucoidan 600-1000 mg daily, polyphenol foods, decalcification, vitamin K2, MK7, 180-360 mcg, vitamin D 6,000 IU, magnesium 400-600 mg, nitric oxide restoration, folate, vitamin C, vitamin E for BH4 protection, hand grip exercises, nasal breathing. Insulin reset, 16.8 eating window, resistance training. Expectations. Week 1 brings subtle changes, less stiffness, slight pressure drop, energy increase. Week 2 shows noticeable systolic reduction and mood energy improvement. Weeks 3-4 deliver vascular function gains, nitric oxide rise, early calcification reversal. Beyond week 4, structural changes appear, reduced rigidity, lower risk, possible medication reduction under supervision. Consult your doctor before changes. Those with kidney, heart, or diabetes issues need supervision. Start 1 step at a time, monitor pressure daily. Challenge: choose 1 vascular element, commit 30 days, track results, share in comments. Your arteries have supported you for decades. Give them proper care. Hypertension is not permanent. Addressing cellular causes can reverse it. Medications manage symptoms. Root correction normalizes pressure naturally. Take steps to prevent events and improve vascular health. Choose reversal over management. I'm Dr. Michael Kent, and I'll see you in the next video.